Hi, my name is John Stan, and I'm a doctor of Chinese medicine with 22 years experience. I also design and import and distribute acupuncture needles throughout North America. I've watched how acupuncture has grown over the last 20 years from a practice that was once considered illegal to one that is now being performed in virtually every area of health care. I make it my business to know everything there is to know about needle manufacturing and quality. Today, I'd like to introduce you to a revolutionary new needle, the TeWa needle. TeWa needles feature the first dual tube insertion system, the safety sleeve, which ensures 100% clean needle compliance. This new guide tube system allows a practitioner to confidently insert longer needles in the safest, most efficient way while maximizing patient comfort. Previously, when inserting longer needles into dense tissue, the needle would bend and bow. This situation forced the practitioner to use an additional aid, a sterile swab or a cotton ball, or sometimes even their fingers to assist with the stabilizing of the needle shaft. The safety sleeve eliminates all of these time-consuming or incorrect procedures. The development of a soft, stabilizing sleeve on the outside of the insertion tube allows you to maintain a clean field around the needle and deliver the needle to your target depth safely and easily. Bimetallic TeWa needles are comprised of a copper wire wound loop handle and a Swedish surgical steel shaft. The needle tip is machine sharpened and needle shafts are available coated or non-coated. One of the things I like about the TeWa brand needle is that the tube is made as narrow as possible to give the practitioner a really targeted insertion zone. Some of the tubes on the marketplace have a larger lumen, which is the area between the inner walls of the tube. With the TeWa, we have a very nice tight fit with a very targeted insertion area. Today, I'll demonstrate how to use the safety sleeve for standard needling, and then we'll cover some technique variations using the safety sleeve later on. The first step is to remove the needle from the packaging. To do so, simply peel back the medical paper on the back of the packaging to reveal the needle and tube. With the TeWa needle, you should always pull the paper backing down until you see the end of the safety sleeve. This way, the sleeve does not get caught on the paper backing as you pull it out. Not doing so may result in leaving the sleeve behind you as you pull the needle and tube. Once you've removed the needle from the packaging, the next step is to remove the needle retainer. Now this can be done before or after you place the needle on the point. You're probably all familiar with tabs and you have your own methods, so I'll quickly go over the basic methods here. To remove the tab before placing the needle, simply pinch both the retainer and the handle and pull away until the retainer is completely out of the tube. Then, with the other hand, pinch or press on the handle and the tube in such a way that it holds them in place while you completely remove the plastic retainer. Then, you return the needle to your needling hand, making it ready for insertion. Because the insertion tube on the TeWas are more narrow, be sure to remove the tab carefully to avoid overbending the handle. The other way of removing the tab is to simply place the tube and the needle on the point with your non-needling hand. Remove the tab with your non-needling hand by grabbing the widest part of the tab and pulling away from the opening. Once you've removed the tab, use your non-needling hand to slide the sleeve down so it's touching the skin. The sleeve is pretty easy to slide along the length of the insertion tube. Don't overpinch the sleeve and then try to slide it down. An easy touch works best. Once you have the safety sleeve down to the surface of the skin, proceed to tap in the needle. Then, while gently holding the safety sleeve with one hand, pull up on the insertion tube and remove it with the other. You can now use the safety sleeve to stabilize the needle shaft and ensure a clean, smooth, and easy insertion to the depth you require. I personally use different gauges depending upon the condition the patient is presenting. There are times when using longer needles like the 40 or 50 millimeter or an 1.5 inch or 2 inch needle, and I really don't need the added stability of the safety sleeve. In these situations, I just don't use it. The beauty of the safety sleeve is that it's there as an additional delivery aid when you need it. Now let me give you some examples of when the safety sleeve has really come in handy. Over the years, I've had patients with a history of severe acne on their back, trying to insert a needle into this very tough scarred tissue to release a point can be really difficult. I've had to use up to 30 gauge needles and use a swab and stabilize the needle as I try to push it through. Now, when faced with a patient with this type of condition again, I would still be able to use my standard gauge needles and use the safety sleeve to assist in getting the needle through the scarred tissue. Another example of when the safety sleeve is useful is when I want to release tight muscles by using the Wato Jaji points on a patient. In these situations, I don't want to go in with thicker gauge needles and overstimulate the area and cause more spasm. Now, using TeWa needles with the safety sleeve, I can use a thinner needle like a 0.18 or 0.20 to do the job. Watch as I locate the L5-S1 Wato Jaji point. I'll needle it with a 50 mm or 2 inch 0.20 or 36 gauge needle. After swabbing the area I want to needle with alcohol, I first palpate the area and determine where I want to place the needle. Then I remove the tab, slide the needle sleeve down to the surface of the skin with my non-needle hand, tap in the needle, and while gently holding the sleeve, remove the insertion tube. Now I'm ready to begin inserting this thinner needle to the target depth. Because the tissues are tight, I will gently increase the insertion pressure on the needle, letting it find its own support by bowing within the confines of the safety sleeve. When you do this gently and evenly, the needle shaft will quickly find the right support it needs, and it enters the tissue very easily. Here's how that process would look without the safety sleeve. As you can see, the needle is bending and bowing and now generating sensations that may cause discomfort to the patient. In this case, I would already be wanting to stabilize the shaft with a sterile swab. As you can see, the difference is dramatic. By using TeWa needles with safety sleeve technology, you're reducing risk and improving your patient's comfort. The safety sleeve now represents the new best practice standard for using thinner and longer needles. Who could ask for more?